Okay. Now, does the chronic cough tend to go seasonally, and maybe be worse in the colder months, depending on where you live? And does it lead to a higher risk of other comorbidities like asthma, like other pulmonary conditions?
So the triggers that people note that start them, get them, into these coughing fits and things like that can be quite varied. And some people do describe, cold air or exposure to, bad smells even or things like that. But I think for most people, it's pretty much a year-round kind of concept. And as with respect to comorbidities, it's probably more associated the other way around, which is that people who have things like asthma or reflux disease, or even postnasal drip, which is often referred to now as upper airway cough syndrome, that those kind of folks often have an associated cough with the condition. And if you can treat the underlying comorbidity, like say the asthma, often their cough will get better just with that. What we tried to identify and target in our studies are the people who either had such a condition, but treatment of it didn't help them. In other words, their cough was refractory, or we couldn't identify such a condition, what we call unexplained chronic cough.
Are we learning more demographic information on the people who suffer, whether it's age, sex? You mentioned some of the comorbidities, but race as well. Is there anything that kind of stands out in that regard?
So what we have observed is that patients with chronic cough, refractory chronic cough, unexplained chronic cough, tend to be a little bit older, middle-aged and older. They tend to be a little bit more predominantly female. We've not observed significant differences across race and other demographics at this point, although I think the data are a little bit sparse there. Most of the data has been observed or been collected in European and American populations, and the diversity there may not be as great enough for us to really get our hand a full appreciation for what that impact might be.
Okay. Now, finding a treatment like this one that works, does that kind of open the floodgates on a condition like this that we haven't had as much success finding new treatments, but when we find one, could that lead to future studies with other drugs and other treatments that are effective as well?
Well, we hope so. I mean, we hope that by bringing forward gefapixant, which we intend to propose as a effective and acceptable safety and tolerability type drug for this condition, that will give not only patients and providers a tool to help them manage this condition, but will also help raise awareness that this is a condition which has not been adequately addressed in the past. And hopefully there will be other therapies that will be brought forward.